Hello and welcome back to Release Point Therapy. I'm your host, Dr. Henele, and we want to get a little bit deeper into this part of hand techniques that we use for the system called superficial fascial expansion. Now we've covered the hold, we've covered the fascial walking, and you can walk forward, you can walk backwards as long as it's smooth and your client's breath is moving. We've covered in walking, sidestepping, moving side to side, and so forth. But one of the things that is very advanced for level 1 practitioners is to have a knowledge of the energy fields of the body, particularly the meridian system. So right now I'm over the urinary bladder meridian, and the urinary bladder meridian is, in this area of the body, has a lot of what are called SHU, or associated points, meaning that the point is associated with, in many cases, an organ. So if we were to come up here and work this first UB line right here, this is about the point UB13 for the lungs. This is the point UB14 for the pericardium, and this is the point right here, UB15, for the heart. So let's say I wanted to energetically work over the heart, as I was also clearing scar tissue and keeping the parasympathetics engaged. Well, you can do all this at once through a technique in the superficial fascial expansion category called acculifting. You find your point, it's right here. You come in and you isolate that point with your fingers. Now notice, this looks very much like the fascial hold. It's right here. I have the point lifted straight up. My three fingers here are assisting. You can see how they're pulling the tissue. They're bringing more tissue to the area so it's more comfortable for the client. And I am, in effect, lifting in a way that allows the client's breath to start to expand. So why don't we take a little look down so we can see how much the breath is actually moving at the hip level. So I'm going, right now I don't have enough of a lift on the point, so I'm not getting a great breath response. But as I start to incrementally lift a little bit better and better, you notice the client's body through the parasympathetic nervous system engages. What's very important is to understand that the parasympathetic nervous system is the gateway for healing into the body. The parasympathetic nervous system gives us access to all the energy fields of the body. And without getting into the parasympathetic nervous system, we'll never really be able to access the deeper energy fields where so much of the emotion lies in the body. I was teaching a class earlier this week and something really cool came up. We said the physical body and the spiritual body communicate through what we've interpreted to be the mind. But it really communicates the physical and spiritual body through a language that we call emotion. The spirit feels something and communicates it to the physical body, and we see that changes begin to take place in how quick the heart beats and how the digestion improves and how tight muscles get. Well, that emotion that's communicated is done so through the autonomic nervous system and through the parasympathetics, which is why we focus so heavily on them in the system. What I want you to see here now, I'm going to give you a little bit of a breath encounter. I want you to come a little bit closer and I want you to listen to this ujjayi sound I'm making, because I have a good lift. My client is now really engaged. Her breath is fantastic. What I want to do now is get into my breath as a practitioner so I can maximize the acculift. And it's the breath that makes the difference between us doing a fascial hold and us doing an acculift. So take a listen. See if I can get louder than this heater in here. Now, as your hands develop sensitivity, and this system will help you to feel things in your hands that you've never felt before. As you feel what's going on in your client's body on a very deep level, you can make micro adjustments. There you go, and we just got a twitch. You can make micro adjustments with your hold to to penetrate all the way through the fascial layers of the muscles and into the mediastinum, where the heart and the pericardial tissue are. And if you're very sensitive with your hands, you can actually feel for the pericardium as I'm doing right now, and find points of tension along the pericardium. There we go. There we go. And then I encourage you, when you're working energetically, to work from a place of purity, where you can feel what's good about you, and you can see the client's body starting to respond, where you can feel what's good about them. Because when you work from that place of finding what's good in yourself and the people that you work with, the energy connection is very easy to establish, and it becomes magnified, amplified, if you will. And it comes into a place of energetic resonance that you can read about in physics, if you'd like, for that matter, astrophysics or just regular physics. But resonance is a place where two waves come together and form a greater amplitude. And it's done through the client's breath, through my breath, through her intention, through my intention, and through the application of this technique in a way that says, I'm not trying to force change on you. I'm not trying to have you be anything other than who you want to be. I'm just here to offer you that opportunity. And that's really where you start to cross over from this being a very structural technique into a very structural and also profoundly energetic technique. And there'll be some points in time where you're touching your client and you just go, wow, I know that feels good. It's just some innate sensation that comes out around you that swirls around and fills the room, that there is some real serious healing going on here on levels that we can't even begin to understand. But just because we can't understand them doesn't mean we can't experience them. Look at that breath. Oh. And ultimately with this system, with all of my students, that's the goal, is to get you, your heart open, to get your body open, to get your energy fields open, to get your hands